computer. So good morning, everybody. This is so fantastic to see everybody here. I am so excited for this webinar that I have been waiting months for. So this is just so truly exciting. My name is Diana Londoño. I'm a urologist in Los Angeles. I'm also a certified life coach, and I am the founder of something called physiciancoachsupport.com, a platform for support for physicians that is free and confidential, which I started after I ran through the coals of burnout the second time. So, you know, this is very common. And so we're here to really elevate, help, support, physicians to really become really whole. And this is really what it's all about. And my guest today is, again, somebody that I have been waiting for 2 months to come on the show. She is from across the pond in the UK. And just a little background of how we met through LinkedIn. And we met when we were both watching a webinar of one of a really good friend, Dr. Tamara Beckford and Jeff O'Driscoll. So if you haven't met them or know them, check them out on LinkedIn or any social media platform. And it was just a really amazing webinar where I felt like, what? Who are these people talking about this stuff that I haven't really heard before, talking about the soul and humanity? And we really were going bananas on the chat and doing a lot of emojis. And I was like, who are you? And so when I said, who are you? There's a good chance that it's somebody that is just really aligned, or somebody that thinks about humanity or the world in a different way, that, is talking about really soul and, spirituality, not religion per se. And so really that's how we connected, and we have really become really close friends. And hence why I did it on Saturday, because she's in the UK and I only use time on the weekends for family. She is definitely family. So I am so excited. This is supposed to be fun, interactive. That's why we were doing some movement at the beginning to get our blood flow started. So again, she is a general practitioner in the UK. She's been one for more than 2 decades. And she is just amazing, because even 2 decades ago, what she really has been involved in are things like lead roles in, deprivation medicine, trauma-informed care, child safeguarding, domestic abuse, which again, this is something I kind of learned about recently, and she's been doing this for decades. And she is also a spiritual and transformational life coach, which, she'll talk about. And it's just a different way to look at things. And some people sometimes are put off just by life coaches. And I get that, I totally do. But really, this is about going a little bit deeper into spirituality, embodying yourself and really putting yourself in touch with what you're feeling. And it really is not about, burning sage and doing things, although you can totally do that, but it really is just going to explain that. And it really is transformational. It really is. So she's going to talk about that. She's also like a mom of twins. And in the UK, they call it mum, M-U-M. So it's super cute, because we, sometimes we have different words. So I love that. And she really, again, is going to talk to us about something she created, again, as going through burnout herself, and how that impacted her. She created this F list, which we're going to talk about. What is this F list? How does she use it? And how is that only not for patients, but for clients? And it can help you today just kind of follow it, so you can get back to your wholeness, your own joy and spontaneity and enthusiasm that, you used to have when you were, 6 years old. You were spontaneous, fun, free. And we are all that, but we forget it. So she's definitely going to talk to us about that. So that was a really long intro, but I'm so excited. Please welcome Dr. Nupi. I'm so excited you're here. Thank you for being here.
Oh, wowza. Thank you so much, my honey. Oh, it's just amazing to be here with everybody. And I recognize some names who've been commenting and connecting already. So thank you so much. I'm so excited. I'm actually giddy. And Diana is so right. We met through comments on a mutual friend, Tamara Beckford. And it was when she literally just said something like, who are you? And I was just in hysterics going, who are you? I need to know you. So that literally, the show finished, we were straight on the phone, and I say we speak to each other every day. If not by phone, it's by text and by messages. And it's incredible. It's incredible. It's what I call a true soul connection.
Yeah, and like I said, before we started the recording, really, I mean, look at the people that are here that we're so blessed to have. These are people that really, you got to know each other if you haven't already, that are just really kind of aligned in a, maybe a similar frequency of things that you care about, you think about. There's some people here that have podcasts that are just incredible, that are coming out of the spiritual closet a little bit, that are really, just really have been transformation in my life. So I saw, oh yeah,
Amazing.
Dr. Judith Hahn just came on. I mean, she is amazing. If you do not know her, please also get to know her as well. So again, be on the chat, please. I'll try to keep an eye on that as well. But, Dr. Arora, please tell us like more. I mean, I don't want to dwell too much on the burnout because I mean, it's very common for a lot of us. And I want to be more, what can we do? Mindset.
Sure.
So, but tell us a little bit like what happened,
Sure.
where were you? I mean, because really sometimes we need to hear from somebody else. Where
Yeah.
were we in that dark place and what happened to make it click? Like, how did you get out? What was that turning point to get out of burnout and then go into this journey path for you? So share that with us because I think it's important.
Sure. Thank you. So it was, I had just had the twins. I think they were probably, I don't know, 2-ish or something. So this is a good about 12 years ago. And, I'm somebody who is upbeat, positive. I love what I do. I love what I do with a passion with my patients, connecting. And it doesn't feel like work to me, to be true. It is a privilege, and it is just, that connection that you have with people. So work for me is not really work, but looking back, I can also see the pressure I was putting on myself. So I'm a new mum of twins, which had its own, even though I'm a child specialist and a parenting specialist in all of this, it doesn't mean you have ready equipped skills there when it's your own children. I remember freaking out going, I don't know how to wash these babies. What do I do? I mean, it's ridiculous, but
it's not ridiculous because that's true. I mean, I had one.
Yeah.
And I don't think I went solo outside of the like grocery store with my daughter until she was like 3. Because I was like, my husband, please come. I don't know, like I get nervous. I don't know what to do with the baby by myself. And it really was 3 years. So the fact that you had 2 at the same time, that is really challenging, no matter if you're a specialist or not. I mean, that's very different for your own. So yeah.
Absolutely. And that was the thing. The only thing I remember was I had to have some structure, and I had a flip chart to know which baby had had the boob, and then I was topping up with formula, and woe betide if my husband did not write down who had had what. I swear it was such a tightly run ship. But looking back, it was the expectation that I'm putting on myself. Mm-hmm. And then returning back into practice 7-8 months in when they were babies. As a GP partner, I've been a partner for 17 years essentially, and a doctor for 24 now. So I'm back in, and it's all male colleagues essentially, and I'm like, no, nothing will stop me and my work. I will be here, and it's almost adjusting to being a mummy, to being the doctor, to being a wife, and encompassing all those different roles. And the one thing I was clearly not doing was looking at my needs at all. At the height of burnout, I didn't even know what they were, to be honest. And it was just give to everybody. Just take it. Was I filling myself up? Was I hell? No. I think it was probably a coffee meeting with my best friend every 2 weeks, which I was like, that was really good for me. Everything else revolved. It felt squashed and pressure. Just like the surface pressure song. It's like pressure, drip, 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 and I was literally going to pop.
Yeah.
And that's essentially what happened.
So important that I just want to emphasize so it doesn't get lost. It's so important to, especially as physicians, when we always are told to give everything to everybody, and everybody's more important, the patient's number one, but then it goes and spills over everything in our life. like
Yeah.
friends, family, husband, kids, they're always first. And we
Yeah.
don't schedule that time for ourselves to fill the
Yeah.
cup, because you cannot give when your cup is empty. And nobody teaches you that. Nobody tells you that. We're just expected somehow to do it for everybody. And when you're so empty, like your gas tank, you're not going to go anywhere. You're going to break down and stop like the car. So I just wanted to interrupt to say, because it's so important that we have to prioritize that. Is not selfish. It's nothing about feel guilty about, because if you don't do it, you will break down just like the car. So go ahead, because you know it's so important, but I want to make sure people hear it that it's okay, we give you permission to do it.
Absolutely. And that's exactly one of the biggest learnings I took away from burnout. And you know, this was 12 years ago, and it wasn't all at once either. It was a gradual noticing, oh, my energy is not great, or I'm tired, and I just put it down to being a new mum. But at the height of it, it was almost I had disconnected from who I am. But interestingly, to everybody else, I was still this radiant energy ball. And it was very much, you know, what people didn't see is, and I remember my husband saying this, he said, you seem to just glide along gracefully like a swan. And in my head, I'm actually thinking, I'm a friggin' swan on steroids right now, because my feet, I don't know how I can keep this up. But did I say anything? No. I did not. I couldn't express how I truly was feeling. There were lots of different reasons for the burnout. It was excessive workload. It was the pressure I'm putting on myself. I had a part to play as well. And when I did stop, well, I had no choice. It was almost like you've said, Diana, it's you need to be topping up yourself. Otherwise, I was running on empty essentially for a good few years.
How did you get to the point where that was like, what was that moment where you're like, this is it, like I'm at my low? And where did you get from, where was that moment? What happened? I know you've shared it before with me, but if you want to or can, just maybe share, because I think it's important that we see that, and then we see that there's a way out, that it, you know, when it's low, there's going to be high. There's seasons in life. And I just listened yesterday, just like sadness is a point between two peaks of happiness. Happiness is a point between two peaks of sadness. So it shall pass too. But tell me, where was that moment? I know it was very, poignant moment. So tell me that moment.
So it was actually one of the last clinics I'd done. I'd been identifying workload issues, etc. And I had just, taken some time out, just a couple of sessions here and there to catch up on things. And really pleased I'd got the workload from here down to here in our inbox tray. This was computerized stuff actually. And I remember coming in to the Friday clinic, and my in tray was like this again. And I was just like, I don't know, oh my God. Did the clinic, seeing a couple of mums, it's always the way the universe brings you mirrors almost. And there were 3 mummies who were struggling. I was doing my thing with them, time out, I could do this for other people. Was I doing it for me? No. And I remember this fleeting thought of, I wish somebody as good as me, not in a big-headed way, but I wish somebody like me said this to me, because you know what? I think I might listen. And that was all it was. I still didn't change anything. I just was aware. And a couple of days later, I was at my parents'. The twins were being babies, they were being toddlers, nothing out of the ordinary. And I just had to leave the house. I was at my mum's, I took the car, and I was like, I'm going for a swim, which is very unusual for me. I love swimming, but I wouldn't just go, I'm going for a swim right now. And as I'm swimming, I had headphones in, and I'm swimming, and it sounds very dramatic now, and I can take a bit of the mick out of myself, but which is a good thing. But I'm swimming, and I am in floods of tears as I am swimming, because I'm choking up listening to this music. It's like it's a Daft Punk track, being chained to a friend, and you don't know who you are anymore. And I had these thoughts of, who would miss me? What value do I bring? And I almost envisaged that I was gone, and I was looking down, And I remember thinking, I can't do that to my children. I really can't. And it was in that moment, and it scared, not scared me, it made me go,
yeah, Joel,
you are so not okay enough. And I went to a colleague who lives close by, and I just said, look, just to let you know, I'm not myself. I've booked in with my GP. I mean, even at the height of it, my perfectionism and unrelenting standards was spot on. I was organizing, sorting. That's what kept me going for so long. But I'd already arranged these appointments. I was very loose, I had very clarity of thought. If I need help, I'm going to get some help now. And he said to me, go for your appointments, take the next 2 weeks off. Don't pressure yourself, see how you go. And I was like, no, gosh, are you crazy? I've got clinics. I can't miss those clinics. I've got a safeguard meeting and blah, 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 blah. And he said, just take the next 2 weeks off. 2 weeks turned into 5 months.
But that's fantastic. That's so needed because, and I want to go back because maybe this could resonate with other people that kind of have been at that low, because when you mentioned about the thought you had about, your children, doing for your children, I mean, it gave me chills, and it reminded me of like my own experience when I was in the darkest, and I said, I'm in a negative place that is so yucky and negative, and I'm Debbie Downer all day, and that's not really who I am. I'm actually kind of, enthusiastic and kind of fun. And when I was in that place, I had the same thought. I mean, I really thought, I've become my mother, who is narcissistic, so who is not really present. So I'm becoming somebody who's not present because I'm just in my darkness, and I can't do that for my children, where I'm not present because, again, I lived a whole childhood and life of my mom not being present because of her disease of narcissism. So it really resonated with me when you share it, because I'm like, that was my turning point as well, when I'm like, what am I doing? I had these children, which I waited, 10 years to decide to have them. And so if I waited this long to decide I wanted to have children, then I need to own up to my decision and take care of them. And I cannot take care of them when I'm burned out in this activity. So, I just, it doesn't have to get to that point, but, something has to be like your catalyst. And again, when it's dark, I know it feels like we're not going to get out of it, like there's no hope, but there is hope. And sometimes you need, which we'll talk about in a second, I mean, a little spark, a little call to action, something that excites you. And maybe this F list starts you in the process, or a coach. You need somebody to guide you, to help you, keep you accountable. So, I kind of want to then go to, really, like, you went through this, you took the 5 months off, that now you're taking your time for you to get back to your truth of who you are. How did this F list, and we'll go through it, how did this F list really come about? And how did you develop? And tell us more about the F list, because I think people need to know and just start using it in their own daily life. But tell us more about the F list.
So basically, those 2 weeks turned into 5 months. And as my own journey, I was lucky enough, because I had private healthcare at the time, and I could access one of the best psychologists going, and he did schema therapy with me. And, I really remember the first few months, I was a shell. And I remember at Christmas time that year, my sister-in-law saying, Didi means big sister in Hindi. They've always called me Didi. Didi's like a broken bird. It's almost like she's forgotten how to fly almost. And I couldn't really speak. I was very standing back and just really wounded, and my heart, I was just empty and broken. But step by step, as I'm learning things about myself, as I'm learning about the perils of perfectionism and these standards and challenging thought patterns and everything I learned, slowly but surely, I'm getting a little bit better. I'm seeing chinks of light. And that is how I kept on developing. I mean, as a perfectionist back then, I listened to the advice to the T. I was the perfect patient, of course I was. But then what came from it was an awakening, and I can only describe it as that. And it was this complete realization of your mind, your body and soul in balance. And that's where this whole awakening, this purpose came from. So fast forward my healing journey, I'm learning and one thing leads to another. It's synchronicities there. I'm noticing for the first time, I'm realizing. And I've always been holistic. This has always been a part of me subconsciously. Burnout was it was the most crappiest time ever. Never want to go there, but it was my blessing because it brought.
To explain to people, first of all, holistic, because again, some people think,
good point.
What is it? Like, is it just you're burning incense and things like, what do you mean?
Yeah.
You kind of mentioned it, but like, what are you doing
Yeah.
holistic? And explain it for people that maybe just feel a little like resistance to
a little bit.
And but be resistant, but just be curious what it is. Explain
so holistic. So holistic is whole person centered care. So holistic, imagine, rewrite it, WHOLE, holistic care. And it encompasses all your health needs, not just the physical. And yes, I love incense and I love my Buddha bells and all of my meditations, and this is all beautiful. That's not what I mean by let's all get down on spirituality and holistic. What I mean is know thyself, value your needs, stand in your own power, and take ownership of your needs. How can you do that if you're not even aware of your whole self health needs? I wasn't. Physical, yes. Emotional, yeah. Mind, body balance, true. But it's mind, body, and soul in balance. And even if somebody doesn't resonate with the soul or the spirituality side, that's okay. It's all around. It's a state of being. And when you are aligned within your whole self needs, you are in balance. And that's when all of a sudden you radiate. And that's what I see coming back in somebody's eyes.
Oh, talk about the eyes. Talk about the eyes. Talk about the eyes.
Radiate.
Tell people what you do with the eyes for people. Tell them about the eyes.
So that's how the F list develops. So it's everything I learned for myself.
Yeah.
My discovery, my learnings over the last 10 years that I have added into the F list and just developed it further. I've basically practiced it on the ground with patient community for the last 10 years at least, giving it out, showing and sharing. And that's exactly what it does. It helps people. It shows you how to reconnect and realign your whole self-health needs, mind, body, and soul.
I love it. And you talked about, you talked a little bit about this whole thing about being broken, coming together, and it made me think about, I actually just learned this on Monday. Judith Hong, who's here, and I don't know the exact name of it, but it's a Japanese art form. Yes. Have these pieces of broken ceramics, and they're broken, and then they bring them back, and there's gold in the broken pieces when they bring them gold, and it's so powerful. Oh, here it is.
Here it is, kintsugi pottery.
Which is so beautiful. And it really brings kind of what you're talking about, like when we're broken, like a ceramic bowl, but then we're going to bring it back together. Then you're going to line it and bring it back to this beautiful gold glittery thing, which again is going to kind of bring into, after you talk about your F list, how when you help people, you see their aha glitter in their eyes, and you bring back that light into their eyes. Which is beautiful when you see that, and it's so important. And if you're not looking at people's eyes, you're not looking at their soul and their sparkle, and their magic. So go through, like you went through all these. I mean, it's been an evolution really to get to this F list. But share the F list, because I think we did at the beginning the fun. We're doing some movement.
Yeah, we were absolutely. So I'm in mid clinic, so I'm better. I've recovered. I am maintaining my own boundaries. I'm aware of my own needs. I'm taking ownership of them. And I'm in clinic and I'm talking to my patient. I remember it was a lady at the time. And I'm saying to her, what are your hobbies? What do you do for fun? As what my therapist had said to me. So I'm sort of bringing bits and pieces in. And as I'm talking to her, I'm saying, your baseline needs, you need to eat properly. Food is very important. Fluids, plenty of hydration. fun. And I'm like, and I literally stopped mid-consultation and went, oh my God, all these words begin with an F. I'm going to call this my F list.
Yeah.
And then one by one, it just came to me. So, you know, owning your needs, focusing on your breath. The breath work is so important. Food, fluids, fresh air, the exercise, fun, doing the things that make your heart sing, connection, friends, connecting with those who make your heart smile, who lift you up, as opposed to, oh, can't be asked to see them today. Oh, but you do it anyway.
Yeah, energy vampires.
It's exactly. Then you've got more in-depth things that I teach. Flip, which is all about perspective. It's all about, you know what? It's okay to have negative thought patterns. It's learning how to detach, observe, and not let them define you. So it's keeping it akin to what I say, shadow self, or the critter chatter, my makeup word for this, that goes on and on and on in your head. Well, the first two F's put a real stop to that. F off. Not to be rude or offensive to anybody.
It's just real.
But it's a very powerful, oh, my patients loved it. I'm like, it's my favorite F. It brings you to the here and the now with an energy force that is so powerful to say, have you looked in on your own needs? Just take a minute and stop.
This is a hard stop. It's like, okay, stop, boundaries, let's put a stop.
Yeah.
Like, we're going to just
focus. Yeah. And
so
that comes hand in hand. It's not about going, oh yeah, F off to this, F off to that. No.
It's a loving
that
it's a love.
to the critter chatter, and giving your time to breathe with focus and breathe. So it's the breath work, which I will share in clinic. I will show somebody how to do this. And that's when you're buying yourself time. It's how I say to people, you can bend time, because when you are in that mode of that breathing, you stay in respond mode, you stay here as opposed to reactive. So you're actually dampening the whole amygdala response, essentially. That's the key to this. It's all scientifically based. It works. Then you check in with the rest of the F's, and the rest of them, it's learning key principles, really, that you define you. Your illness doesn't define you for patients. Your circumstances, they don't define you. I would love to be able to wave a magic wand on the patients I have been involved with, traumatic backgrounds, really crappy childhoods, all of these things. I can't. We cannot change a past that's already happened. And until we've learned how to be in alignment and influence our future, right now, the what ifs and buts of the future is again out of our control. The only thing we've got control over is here and now.
And the choice. You're talking about this a little bit of the flip, but you Viv put out a great comment, like what other people think of you is none of your business, but also we have a choice. We can't control everybody else or the situation or the trauma that happened or your illness. You don't have control of that, but you have a choice how you're going to respond. And you know, there's great books about it, like Judith Eggers, The Choice, which is about Holocaust survivor. There's Viktor Frankl's also for Meaning. I mean, these are great examples of, if you read that and you don't feel you have a choice, I mean, we got to sit down and talk a little bit more about this, because we have a choice.
We always have a choice.
We have a choice of how we're going to, you know, experience, act, everything we're going through. And either you're going to be sitting in the molasses of anger, frustration, victimhood, or you're going to, you know, make lemonade and make the best of that and use it as a learning opportunity. Those are your learning opportunities for growth. You have to go through the darkness to get to the light. So I love that, you know, we are talking about, first for F off, but with love. I mean, it's just about putting a boundary. Then you got to focus, you know, this is so important. And then, you can go on. But I mean, I just really wanted to bring it because we stay in this victimhood so much. And nobody teaches us that, like, we have a choice. We do have a choice.
Yeah, and I think where this really has come from is that, to be a healthy adult with responses and with, living your best life, you need to have a healthy childhood. And that's dependent on love, nurture, support, boundaries, room to grow. And with the best will in the world, not everybody has that. Who you are as a person is dependent on your upbringing, your culture, society around you, things that maybe have been even inherited. And these are the things sometimes out of our control. But the two things that is so crucial with my F list, and what I always hone in on and remind people, is that just what you've actually said, Diana, that you have the power to govern your thinking, and you have the power to choose. It might not feel like there's much to choose from. And understanding a mentality of somebody being stuck, well, they know that. That's their normality. Anything else is going to feel even more scarier. And it's giving yourself the grace and the courage to go, this is making me feel a certain way. Respond to that feeling. What the thought is, okay, F it off for a minute. Focus on your breath, breathe. Because when you are staying in that respond mode, all of a sudden your choices, you're expanding your possibility of choice. That's the whole purpose of this.
You get a little space for
exactly.
the action,
And that's the thing. This is the empowering bit, is that you get to govern what happens next, not the other way around. It's flipping the perspective. Oh my God, everything really crap. Oh my God, how many times have we heard this as a clinician? Everything's going wrong for me. Ding, 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 ding. And actually, if you detach and take a step back, okay, well, was it really everything happening to you personally, or was that just the way it was? And learning to see it like that, as opposed to stepping into that emotion, is absolutely critical. And it's okay as you're learning this. You have to practice. It's like anything. The more you practice, the more it becomes consistent. It becomes more habit. But even if you did step in, always know you can step back out. And that is the power of these words, because after flip is fabulous, which is all about your own vulnerability, which is
fabulous. You said fabulous?
Yeah, fabulous.
Oh, I love it.
Fabulous is the last F. And it is all about vulnerability, the power and the strength within the, even at the height of what you're going through, be it physically, emotionally, everything feels like, oh my God, and I'm a failure, and I'm this, and I'm this, and I'm this. It's not weak. It takes a lot of courage to stand in that negative headspace just for a little bit and delve further. What is this showing me? What can I take from this? That takes an immense amount of courage
and work.
And I always encourage, and work. And I always encourage my patients, this is your normality now. You've told me how you're feeling. You either want to feel like this and continue, or you don't. It's really quite straightforward. And I simplify it like that because it's not simple. It's not easy to do this. But when you optically look at it like that, you already know, I don't want to feel like this anymore. I might not know what to do and how to get out of it, but I know I don't want this anymore. So I'm showing you don't want a different path.
Correct. Yeah. That's a good point. We always focus on what don't I want, but what do you want?
What do you want?
If you do want to feel good, to be happy, to be joyful, what do you have to get there? So we gotta focus our energy on what we want, because law of attraction, what you focus on is what you'll get. So if you focus on the negativity,
that's exactly,
and the molasses and how terrible everything is, you're gonna just stay there. And if you really,
and that's one of the F's.
Yeah,
that's one of the F's.
I mean, flow.
It's about being, and it's being in tune with your needs, in tune with yourself, in tune with others and the world around you. Because when your perspective is shifted, you can actually, this is the magic and the glitter, you can absolutely manifest and create the life you deserve. It's your birthright to live in joy, to have purpose, to have passion. And what tends to happen, you forget this. And everything, then you go into kind of autopilot mode, day in, day out, Groundhog Day. And I'm literally blasting that and going, you get to choose what you do, but know your values, know your worth, know what your needs are, maintain them, understand when they're out of balance, learn with patients, particularly, what is your people come to you when their symptoms are so loud, the body's manifested whatever's going on, for them to take notice. And I'm saying 5 steps before that is when you probably started feeling this, because you're feeling it here and here, and then your body's deciding now to react because you've ignored certain signs or you've ignored certain thoughts. It's, blocking things.
I'm guilty of that. I mean, I like manifested like a whole energetic explosion in my body from the stress. Absolutely. And I tell it to my patients too, because they come in and they're like, oh, this hurts here and there's overactive bladder. And I said, it happened 3 months ago. And I said, okay. I was like, bring me back to maybe 4 months ago. What happened 4 months ago in family, work, this, that? And then people are like, oh yeah, this past year, 8 people died in my family. And then they start cheering up and the grief just like goes over. And I'm like,
people forget. And I think medics are the worst. We're the worst, actually. We teach this to patients, and if you're aligned or enlightened, fantastic. This learning, sorry to interrupt you, Diana, sorry.
I did to you.
And we're just like, oh my God, yes, so much to tell you, so much to tell you. This is what we do.
Sorry, people.
I wasn't taught this in medical school. I wasn't taught this in junior doctor training. I've learned the hard way
through the fire
how to, and walked through it to come out of it. And I knew that was my purpose and well, it's been my passion forever, but my purpose is to bring it back into the community of my patients at that time, which I've done for the last 10 years, combining it, that holistic foundation with the science of medicine. Holy shamoly, as you would say.
Holy guacamole.
Wow. The transformation. I'm living proof of it. And this is what I would say. I'm talking to you guys as I'm talking to my patients. I'm sharing what I've learned with my learning, with developing, obviously. I swear by this. I wouldn't say this if it wasn't working. And I think that's what gives it the authenticity and the credibility. I've also shared and practiced this on the ground for the last 10-ish years. And the impact it has on people, phenomenal. It never fails to inspire me, to uplift me, because what I see from that holding space, the eyes, exactly, holding that space as a physician, as a clinician, there aren't any other professions really, apart from maybe social care, who are allowed that access into somebody's life. It's unconditional levels of trust. And because I love dancing and clubbing and all of that, well, I did when I was younger. The way I see it, it's kind of like you get the gold, you get the VIP access. You've got the gold rope. You go into that gold rope access of their life.
Yeah, of course.
That is a gift. That is a privilege, and it's precious. And for me, if I'm a community doctor, a family physician, VIP access is a good one. I know, I love that. I've written that in my book, actually. That is a privilege. Use it. As a family physician at the heart of a community, too damn right, I'm going to go there. Too damn right, I'm going to tune in, which I do. I know what's wrong when people come in. I can see it in their eyes. There's a discord between their physical symptoms and what they're telling me. And I'm like, so what's really going on? Blah, 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 blah. And just even going through maybe the first 2 Fs when I've held space, listening from here, not from here, listening from here and here with all your senses. And showing somebody else, okay, it doesn't have to be like that. There is a different way. And you've got your scientific background, for heaven's sake. So it's all mushed in. When I've done the breathing exercise, for example, people are always completely bowled away. The fact they think it's been 20 minutes. And I'm like, oh, I could do with a quick breathing. So I grab their hands, create the space, and talk them through visualization, cleansing, clearing, bring you back to center. And I always look at the clock, and it barely a couple of minutes have gone by, but it feels like 20 minutes at least.
But it's so important. We gotta breathe. You know, if you stop breathing, guess what? You die, right? You die. So you have to
focus.
And I do that,
and
with
it's the intention.
I do it like they come in, they're nervous about their biopsy or their procedure, and I'm like, okay, slow down. We're gonna breathe before we start, and we're gonna breathe through it. And we really spent, you know, at least 3 breaths to start before I start anything. And I breathe with them. I'm like, we're gonna breathe. You and I need it because you're nervous. And then, you know, I gotta be on this. And we're gonna breathe. So we're not gonna start until we finish our breathing exercise. And this, especially for procedures that I do, if you're tight like this, I cannot put my instruments in places that have to be like that, because your sphincter's like this. So relax your sphincter, relax yourself, so we can do our work. But absolutely, I do that, and it's not woo. Like, I mean, you're breathing. Relax yourself. If you don't breathe, you're gonna die. So I don't need you to hyperventilate. I need you to slow it down. And I also don't tell them relax, because when you tell them relax, nobody relaxes, and it's like,
no, of course they don't.
I say breathe. So
listen to my voice and breathe. Work. Yeah,
so
absolutely.
So,
absolutely.
So we have to do this. It's important. And I love, like, of course, you've done it with patients and for 20 years, but now you move to really your real true calling to do it for physicians, and, you know, not just physicians. I mean, you really do it for other people, and you walk them through this FLS, and you help them and you guide them, and you really are. I mean, this is why you're a spiritual, you know, transformational coach. One, because it's a spirituality about being aligned. And it's not about we're going to pray to, you know, Buddha or Jesus or the Virgin Mary. It's just about spirituality. And then it's about really, you know, getting in touch with that authenticity, because that's how you start to heal. You start to, you know, see all those scars and wounds, and then you really, like, show them again, there's a light inside of you. And that's really what you do for and
people. It's magical.
It is magical.
It's so much. I mean, there is so much more to you know, in medicine, there is so much more to health than just tablets, medicine, medical practice, or the conventional medical model. Don't get me wrong. I'm a scientist. I'm a woman of science, for heaven's sake. I look for evidence, but when you know the baseline foundation, and then you add in the knowledge base, the evidence-based, scientific stuff that we all know, that's when you achieve with somebody the real, true, lasting transformation. It never not works. It's healing.
Like, not just the prescribing or the transcribing, but the healing. And again, I do that with my students, because we can give them lots of meds. And I said, I can give you the meds. I'll give them to you so you can, until you get better, you don't feel awful and you pee every 2 seconds. But then we got to work on this. If we don't work on this, you're not going to just get better. So we got to work on this.
Exactly it.
Yeah, totally.
Yes. And it's important to say, look, I'm not saying everybody has to do in healthcare, or if you're a doctor or a healthcare professional, everybody has to do this. No. I'm sharing, I guess, my story of burnout, what came from it, because actually the nuggets that have come from this is how you can actually maintain and empower yourself. Be it a physician, be you are a teacher, it doesn't matter who you are, it doesn't matter what you do, and it doesn't matter, you know, how old you are either. This applies generically, and that is your foundation. Because when you're not well, you forget about your basic needs. Everybody does. I do. And to come back a little bit, because I wanted to say about the light that I see and feel. When somebody has gone through that breathing and it's a couple of minutes and they're like, oh my God, Dr. Arora, has it been 2 minutes? It felt like 20. That's my patients, that's how they speak, some of them. And then when they open their eyes, I can feel it. That's what I call fizz tingle. it's that energy transfer. My patients can feel it because I can see them going, oh, something's shifted. And I'm like, can you feel that? Yes, it's the vibration, it's the energy. And as soon as I start saying that, I've not mentioned the word spirituality, but they know what that feels like.
Yeah.
They know because they felt it there and then. And I'm giddy pants because that is what makes me light up, because I'm like, me sharing this with you is a win-win cycle because I am receiving as well. And I love doing this. I could do this all day. This is not exhausting or tiring. I do this forever if I could. But
it's that energy transfer
eyes.
Is the drist, you know, they call it in, you know, in other, you know, spirituality, the dristi is called that energy, that light that you transfer through the eyes. And again, when you acknowledge that soul in front of you, that is really powerful.
And that's what I say.
Yeah, when you see somebody depressed, you know, they don't eye contact, their eyes are, you know, dull, they don't look at you. And when they come back, it's like, you know, like the eyes. I mean, make me think of, I just did surgery on this lovely man who had a catheter for a whole month, like he couldn't pee, I mean, a whole year, he couldn't pee. And, you know, before surgery, he was just, you know, depressed and down, and like even his picture on the medical records, he just looks like down. And he was just really depressed. And he had like, really, he told me later, like lost hope in life. I did his surgery, the guy peed after a year of having the catheter. And when he came back, my nurse, who was fantastic and is the best and totally intuitive angel, she's like, he looks really different. Like he kind of has a little sparkle in him. I mean, I'm like, oh, okay, let me go see him. And I mean, he was like a whole new man, 10 years younger. I was like, what? Who are you? He had light in his eyes. He was so happy. He said, thank you so much for doing this surgery, because I had lost hope in life. I had lost hope living with this catheter. And I don't blame him. I mean, it's awful. And then this time, you know, I did use my technical skills. Granted, that's fantastic. But I can use my technical skills and also be present for them and acknowledge their humanity, their pain, their discomfort. And it's so important to use both, like you said. Yes, absolutely. Technically, I can use it and I can do your surgery, but I'm acknowledging your pain. I'm acknowledging now your happiness and how it brought the light back in your eyes when you didn't have the light. It's so powerful. That's
exactly it. That's the glitter. And that's what I say to people. I see you. I feel you. It doesn't need to be like this. And when they've done that and when they've received, what I see in their eyes, you see the glitter of light. And I literally say to my patients, oh, I can see your light, your eyes sparkling again. And
that's why you're the glitter practitioner. That's why you're the glitter practitioner. And show them the glitter. Show them the glitter.
Okay. She's so bossy.
Show them.
She's like my bossy little sister. I don't. Can you see? I did it all really specially today. So I am obsessed with glitter, which is why that's also it. But can you see?
Beautiful. I see it. It's beautiful.
Thank you.
I can talk 100 hours, but I want to go. So you talked to me about F off, focus, fluids, flip.
Focus and breathe. It's not just focus. Focus and breathe. Yeah.
Fluids, flow. What did I forget? I want to make sure we
stop. Stop.
Other than
stop. It's all out of order. It's really
do the order. Do the order.
So the order is.
Tell me the order.
F off. Focus and breathe.
Okay.
Now tune in to your needs.
Okay.
Food, fluids, fresh air. Next one, fun. Then friends. Then you've got flip. Then you've got flow. And then you have fabulous, because you already are as you are in the height of what you're going through. Then 3 powerful affirmations that come with the F list. This is all about ownership. There's no coulds, there's no shoulds in the vocabulary. I'm banishing them. I'm feeling very bossy now. I will. Yeah, I know. I will. I want to. I am so friggin' Missy Elliott worth it. So it's not the hair flick worth it. That's it. It's too pansy. It's a sassier I'm worth it. So it's kind of like, I'm worth it. Yeah, worth it. and deserve it. Yeah.
Okay, I like it.
That's
So
worth it.
we're gonna put that on the replay. It's gonna be on our site. So if you want to watch the replay, we'll put it in order because I also messed it up again. So that's okay, but I will fix it on the replay to put the atlas in order so Dr. Nupi doesn't yell at me. So it'll be on
Made something for you.
Physician Code.
Made something for you.
Okay, thank you. physiciancodesupport.com webinars, it'll be there. There's also the YouTube channel, they'll be there. There's also some fun things, which will include, we're doing a movement. We did a movement video that's coming out maybe in a couple of weeks that we move for wellness now. So it's gonna be movement and about messages of hope and unity. So that Dr. Nupi is in that video, which will be coming up. But tell people how to find you, because we talked a lot. I don't want them to miss out. How do they find you? Where do they find you? Where are you? Please tell them where do they do, which I know LinkedIn is a big one, but you're everywhere.
Yeah.
The glitter. So where are you?
Yeah. So mainly you can find me on LinkedIn. So please connect with me, just reach out to me. I do a live show, a LinkedIn live show every Monday at 8 p.m. UK time, and that is noon Pacific Daylight Time. I love saying that bit. I had to do that bit because I just love it.
And
so
we
that's
do
every
have some
Monday.
of your guests, Anthony Reed, who's was one of your guests. He is here today.
Yeah,
so shout out to him for being here. And
hi, Anthony. Thank you so much for joining and watching.
And what a great guest you have.
I have the bestest guests on, and Diana, you're going to be on soon. And it's about talking holistic care, holistic care and marrying it up with what other people are doing, showcasing other people, and what and balancing it out with, all right, this is like this on my F list, blah blah blah. And then you can find me on Instagram, The Glitter Practitioner, as well as YouTube, The Glitter Practitioner, and there's somewhere Facebook. It's all The Glitter Practitioner basically. And what I've made for you actually, Diana, is a very special F list. And I realized I forgot fun. I forgot to say fun on the F list. Never mind.
No, it was on there.
It was before, but I didn't bring it in now. I've made something that I'm more than happy for you to share out loud. And it's just a very beautifully created, because I've really got into my creative skills on Canva and CapCut and stuff. So I will share that link because I'm really proud of it.
Okay, well, that's how they can find you.
It's the F list is what it's the F list.
We're gonna do a nice F list that won't be out of order, I promise, or she'll get mad. So please connect with Dr. Nupi Arora. She's in the UK time, so just know that, but she always is up way too late or up too early, just so you know. But she is amazing, fantastic, super fun. I want to be mindful of everybody's time because it's Saturday, and so I do appreciate you being here on Saturday. And check it out again, physiciancodesupport.com/webinars. You can see them all. You can see the next, we have amazing guests coming up soon. Susie Sharp, she's an amazing artist with shows in Milan, Miami, internationally. She's coming up next month. I can't wait to speak with her. We have Dr. Victoria Aguilar, who's here today. She's going to be talking about menopause and what it is, and giving this message to our communities. The Latin community is so important. We're always usually left behind in a lot of screening and care. So we're so happy to have her voice, her fire, her flame, just her to be part of that. So there's a lot of amazing people coming on. You could watch the previous replays, shows. Amazing people that I really, really, truly love. Some really famous people who are on Netflix are also there. So if you watch Netflix, you'll see somebody famous there, who is my soul brother, Dr. Niraj. So Meta. So he's there. There's a lot of people there. Fantastic. Really connect with them. I'm so happy you guys came. Namaste. Thank you so much. And I love you all. I will see you next month.